Assalamualaikum warahmatullahi wabarakatuh. The Honorable the Judges. First, let's thank unto our God who has been giving us some mercies and blessings until we can attend in this happy condition, although via online. Before I jump to my speech, I want to ask you about COVID-19. Do any of you know about COVID-19? Well, of course you do. Coronavirus disease is an infectious disease caused by a recently discovered coronavirus. COVID-19 pandemic is a challenge for health system around the world. The rapidly increasing need for care for people with COVID-19 is exacerbated by fear, misinformation, and restrictions on the movement of people. Decision makers must make tough choices to ensure that COVID-19 and other pressing public health problems are addressed, and while still minimizing risk to health workers and the public. These community-based platforms with the capacity to provide health services and social involvement has an important role in the response of COVID-19, and it is important in meeting existing health needs, especially for the most vulnerable people. Using a comprehensive and coordinated approach to community-based activities provides an opportunity to strengthen the resilience of community-based platforms into the early and post-recovery stages. What we can do to ushering towards equitable and affordable healthcare system after the COVID-19 pandemic? That is, community-based health services. These health workers include both lay and professional, formal or informal, paid or not. In every community, there are local actors, relationships, and processes related to health sector. And related actors include government, religious leaders, and non-governmental organization communities, as well as local community groups. Decision makers must balance the benefits of virus with the risk of transmitting the virus to health workers or from health workers to others. Also, we can do time-sensitive condition and community-based acute care. Such program use a picket system and first aid personnel who can be called in 24 hours to provide basic care for acute illnesses. In various places, apart from providing on-site care, they also accompany patients to ensure that patients arrive at the facility safely. Strong community-based platforms, acute and emergency care can help with access morbidity and mortality during and after the COVID-19 pandemic, building more resilient systems. Also, we can do involvement between community and communication. Communication is meant to focus on building trust, reducing fear, and informing people of the use of public health measures. The main topics to communicate are transmission of COVID-19, public health measures to reduce the risk of transmission, and risk factors related to severe disease. By holding special telephone service or hotline, question and answer session, using a digital platform to dispel dangerous myths, and also stop the spread of misinformation. Family self-care at home that is necessary for all household members to meet health needs. Home care for people with mild to moderate COVID-19 symptoms as per national guideline. Use existing digital platforms for remote consulting and informal dissemination. Identify mechanisms for providing services that are inclusive of persons with disabilities. As noted by a British journalist, David Ernovich told the BBC about his experience in the ICU after being sedated while undergoing treatment for pneumonia in 2011. He often becomes angry and suffers from auditory hallucinations, thinking he can hear other people who he can. And with condition like this, COVID-19 friendly ends It takes personnel from physiotherapy and psychology to improve post-traumatic stress, body image, and other cognitive problems with affordable services. For recovery, it takes 1 year because of the trauma that has occurred to those who have never been positive together. They need recovery. And because during intensive care, they may not remember having been in the ICU. Therefore, health workers can provide affordable services by keeping an ICU diary so that at least after the COVID-19 pandemic is over, they can slowly remember their experiences. To carry out efficient and affordable healthcare can be done by means of virtual consultation. And after the COVID-19 pandemic ends, to limit movement in hospital, you can consult through an application. Maybe that's all from me. I am Putri Regita from Smadadi Makassar. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.